There was a lot of information in this medical plans portion of your course. Remember that in most states, it makes up a big part of the licensing exam. You could potentially see more than a dozen questions from this topic area. Also, remember to spend a good amount of time on the state content outline bulletins I mentioned earlier. They're basically your roadmap to passing the exam. If you recall, the outlines list the items that will be on your test and how deep any particular section of the examination will be. We started you off with a basic discussion on medical plan concepts, such as fee-for-service plans and prepaid plans like HMOs. Then we continued with a look at the benefit schedules and compared it to usual, customary, and reasonable payment basis, or UCR. We saw how benefit schedules are put together using data from geographic areas and the typical cost for a procedure, as compared to UCR payments, which are based on the average cost within a region. During all this, we gave you a bit of math to work with. The state exam does have a few questions that require you to perform some math, but they're normally made up of nice round numbers that are easier to use. Be prepared to discuss the different types of deductibles, co-insurance, and co-payments, and determine who pays what in the event of a loss. These deal with cost containment and cost sharing provisions within a policy, which are large considerations in today's insurance world. Basic plans were also explored, and we discovered that they aren't that modern compared to more current types of plans. But at least there was no co-insurance or deductibles. We then began to learn about the modern policies such as HMOs, PPOs, and major medical coverage. Make sure to concentrate on which medical delivery system has what attributes. As an example, HMOs have strict network requirements, co-payments instead of co-insurance, a primary care physician who acts as a gatekeeper for the plan subscriber, and are prepaid plans. PPOs are essentially a blend of HMOs and major medical policies as they allow the subscriber to seek treatment in or out of network without requiring a referral or an emergency. But PPOs have contracts with network providers to charge less, and there are no contracts with non-network providers. Major medical coverage offers the greatest freedom of choice, but it also is the most expensive plan when comparing the three major delivery systems. Major medical has no network considerations as they are any provider plans. The coordination of benefits, or COB, was also briefly discussed. This comes into play if a person has more than one policy that might apply to a loss, and determines which carrier will be the primary insurer and which would be the secondary or excess insurer. This provision also prevents overinsurance and an individual from being able to profit from a claim. Our segment also took a close look at the Affordable Care Act and its effect on medical coverage. These run the spectrum from children being covered until age 26 and preventative benefits, to the essential benefit coverage requirements in all plans, and major changes to how carriers can apply exclusions for pre-existing medical conditions. The creation of the SHOP marketplace for businesses with 1 to 50 employees was also an important part of legislation as it gives group coverage opportunities to smaller businesses, even a group of 1. The producer's role in the marketplace was determined, and the different types of ACA plans were covered as the metals. Remember the bronze, silver, gold, and platinum plans? Depending upon the selected plans, the co-insurance percentages differ for each of them. We looked at less expensive plans meant to cover more catastrophic needs. They will usually have a much higher deductible, and as a result, much lower premiums. Ways to appeal and having insurance coverage and benefits decisions reviewed were also shown. The fines and penalties that go along with failures to follow ACA regulations were then detailed. Remember that there are no more individual mandate penalties from 2019 forward under current federal law, but individual states may have their own mandate. How the Act changed an insurance company's ability to exclude coverage for pre-existing conditions was thoroughly explained, and we discussed how a carrier may use pre-existing condition exclusions in certain circumstances. Toward the end of this lesson, you studied HIPAA and all its attendant insurance regulations. An important piece of law, HIPAA did a tremendous amount to help secure and maintain coverage through its creditable coverage allowances, regulatory changes involving pre-existing conditions, and how policies must be allowed to renew. In our segment on the privacy rule, we discussed how individually identifiable health information must be protected, HIPAA authorizations, and the standardization of electronic code sets, which are used by medical providers and insurance companies. That was a tougher lesson. And remember that it's a big part of the state exam, so spend a good amount of time here.